Welcome, everyone, to the training webinar series, Eyefinity Encompass Conducting a Simple Eye Exam Presentation. Thank you for joining us today. We look forward to your questions throughout the presentation. You can enter them by clicking on the Q&A icon on the right of your screen. My name is Linda Park, and it is my pleasure to be with you today to introduce Michelle Brocious. Michelle has been working in the optical industry for over 22 years, 5 years in an optometric practice, and 17 years in training and implementation at Eyefinity. When it comes to training, Michelle has done it all. Recorded training videos, developed training materials, presented live WebEx group and hands-on sessions, conducted on-site training and presented excuse me, and presented at Eyefinity education conferences. At home in Ohio, Michelle enjoys spending time with her family and grandchildren. Welcome, Michelle.
Thank you so much, Linda. We are going to go ahead and get ready to get started. Like Linda said today, we are going to be going over performing a simple eye exam. You can do that now from this single screen. Recent updates made it easy to document exams directly in the visit overview on the web and also in the detailed visit overview on the iPad. Also, new input fields have been added to the impressions and plans card, allowing you to document diagnoses and plans without needing to enter into the ocular exam. So I'm going to start off on the iPad first. So give me a minute and I'm going to start to share my iPad with you. So I will start broadcast. And if Linda, you could let me know if you can see my iPad.
Yes, I can.
All right, perfect. So I'm
Thank
going to go
you.
ahead, like I said, you're welcome. I'm going to go ahead and log in to my EHR environment. One second to log in. All right. So on the iPad, we started out, and I'm on the agenda tab. So this is where all your patients are listed from your appointment scheduler in Encompass. So it's really nice having the agenda tab pop up first. You can actually copy forward a visit or you can create a visit right from the agenda tab. So I'm going to use my patient, Lucio Ball, and I'm just going to tap create visit. And that's going to open up the patient's chart. The two views that you have are in the upper right-hand corner. This is the detailed overview screen. And then if I click in the upper right, the little square boxes, you're going to see the other view that we have. To perform that simple eye exam, though, you do want to go ahead and select in the upper right the pancake view. And this is where we're going to start documenting that. So everything is on one page in here. Over on the left-hand side, you'll see visit settings. This is where you could go in and manage. And once you tap manage, you'll see the provider in here. If you needed to add any preferred attendees, if you have a scribe, bill visit as, in this case, this is a new patient, but this is very important. You want to make sure whether this is new or an established patient. I have my time zone in here. And then another feature in here is the archive. So if you would have opened up an exam in error, you can archive it by tapping the archive button in the upper right, and that will hide that exam and take it away. So I'm just going to cancel out of here. I already entered my history for my patient on the left-hand side, but it's really easy just to pop in here if you need to add anything. So maybe since the last time my patient was in, or in this case, I said it was a new patient, maybe they're taking some meds. So I could go to the medication tab just by tapping on the blue link. And then I could go in here and I can update my medication list. So in the upper right-hand corner, or excuse me, in the upper left, I could choose add medication. And maybe since they filled out this information, now they're taking a baby aspirin. So I could just start typing it in. I'll scroll down here. That's not a good one, I guess. Let me type something else in. Let's say that they're currently taking, maybe they're on like some type of inhaler. So we'll do albuterol. Okay, so I could just select it and it's going to bring up the different dosages. You'll notice up at the top on the blue hyperlink, it says add with unspecified dispensable. So if they do not know the dose, you can add it without the dose in. I'm just going to go ahead and select the second one, and it's going to drop right into my patient's record. And then you'll notice on the left-hand side, you can go down and view all their clipboard information and add as needed. And once you're finished, in the upper right-hand corner, you're going to select done. So there's all my medication and all my family history and everything on the left-hand side. So the next thing we're going to do is add in our chief complaint. So right on the blue bolded bar, you'll see add chief complaint, HPI-ROS. There's a drop down arrow. And then this is where you could go ahead and put in your chief complaint. You can do a follow-up complaint, other complaint. If you would rather type it in manually, you can actually tap on that and you're going to fill out the information that is required with the asterisk, and then you can manually type in. I'm going to go ahead and tap that again. And then you'll see your review of systems at the bottom. So I'm going to actually select chief complaint. These are my top complaints. Again, you can go to other down at the bottom, or you can search for a complaint that you're looking for. Okay. So I'm going to say this patient's coming in today for just a comprehensive eye exam. It takes me to the location. I'm going to tap right and left, indicating OU. In the bottom right-hand corner, I'm going to select complaint details, and I'm going to indicate that this is a comprehensive eye exam, not a follow-up. You have an arrow to the right that you could tap through, or there's tabs up at the top. So what brings the patient in for this exam? I'm going to say they're blurred a little bit at distance for their eyeglasses. If they have any kind of associated symptoms, I'm going to tap dry eyes. And you can document whatever you need to in here. I mean, you don't have to go through every single tab. It's all about how much that you want to document throughout this area. So I'm going to say mild in severity. Duration, it's been, I don't know, a few weeks. And then in the bottom right, I'm just going to save my complaint. So that takes me back to my detail overview screen. And you'll see right here that my chief complaint and my history of present illness are finished. If I tap one more time where it says add CC HPI ROS, now I can go to my review a system. And then if this is a new patient, you can mark them all reviewed. If this is an established, you can mark this custom. This whole page is customizable, and this is done in the firm administration side of the program. So I'm just going to tap mark all reviewed for my new patient, and I'm going to turn the button from no to yes, indicating that they're having a little poor vision, maybe a little redness from the dry eyes. And then I'm going to save ROS in the bottom right. And again, it takes us right back to our detail over screen. Okay. So now we have in our chief complaint, we have in our review of systems. So if you just scroll down and follow this, you'll see vision exam. Now this is a little bit different from the browser. When you choose vision exam, you're going to tap manage, and it's going to bring you to the pretest area. So you have all the tabs on the left-hand side. So we have our wearing what they come in your office presenting, where we can add glasses, soft contact lenses, or specialty contact lenses. I'm just going to tap add eyeglass. And like I said, this is a new patient. I'm going to put in my eyeglass type. You can enter the usage if you wish. And I'm going to go down under the prescription and I'm going to add my prescription in. You can copy to the right-hand side from OD to OS, and then you can modify as needed. Up at the top above the eyeglass usage, you'll see visual acuities. So if you enter the VAs here on the wearing tab, they will populate over to the visual acuity tab. So I'm going to go ahead and put my visual acuities in. And I'm going to save it in the upper right-hand corner. Okay, so there is my wearing prescription, what they come in our office presenting. Also on the iPad, you can mark the pupils, motility, and visual field all within normal limits in one click of the button on the blue hyperlink in the upper right. So that'll mark all three of those within normal limits. And then we have our auto refraction tab next on the left. So if you're using an auto refractor, you can add refraction. We have our Ks, visual acuity. Like I said, I put them in on that wearing tab. So they populated here on the visual acuity tab. Refraction tab is where you can select in the upper right your manifest, psychoplegic, retinoscopy. I'm going to choose my manifest. And then because I put that wearing prescription in the upper right-hand corner, if I click view import refraction history, you're going to see what I entered in a few minutes ago. I could bring in my wearing prescription by tapping on it and choosing import in the upper right. And that would pull in that prescription. And again, if I need to modify, I'm just going to tap into the fields I need to modify. So if I want to bump up that minus 75 to 1, I can do that. And again, just by tapping in. Okay. Now I can go to my visual acuity tab next to the refractions tab up top. And I'm going to say we're all good. We're 20/20. I could set them at 20/20. And then again, in the upper right-hand corner, I'm going to go ahead and save. Okay. Right from here, you can create your final prescription by choosing plus final RX. You do have additional tabs above the prescription. We're on the RX detail tab now. You have lens details that you could recommend stuff, frames, and then notes. On the notes tab, you can choose whether or not you want to include the notes on the patient's printed out RX. Okay. In the upper right, you can save and send this over to Encompass, or you can just go ahead and save it. Let me throw my usage in there real fast, and I'll save. Okay. So like I said, you can send the RX from there. You can send it here. Whichever way you want to do it is fine with us. Okay. Then we have the binocular tab. In here, the first thing that we did in here is your eye dominance. Makes it a little bit easier for you. You have a jump to section in here in the upper right where you can just pick and choose in this binocular area what test you want to do, or you can actually scroll down. Okay. So I'm going to go ahead and scroll down a little bit. I'm going to put in my IOPs. The IOPs are now up at the top of the screen. I'm going to copy OD to OS and again, save in the upper right. Okay. If you need to add a new one, you can select plus add new IOP right here on the iPad. Okay. I'm going to go ahead and save and then just cancel out of here and tap back on my overview screen, and you're going to see everything I just documented in the vision exam. If you would need to go back in, is all you got to do is tap manage it again to get back in there. All right, I am going to just tap on my other view real fast and back on. And then I'm going to show you where we're going to perform that simple eye exam. So right underneath the vision exam is where we can perform that simple eye exam. So we just tap on simple eye exam. Okay. This is where you can add in your findings. You can enter in your CD ratios. In the upper left, you'll see the arrow that says options. If you tap on that, you can indicate whether this is a dilated patient or non-dilated. I'm going to say patient is non-dilated, and I'm going to put deferred. I'm going to turn that to on. To get rid of that drop down, you just tap back on the options caret, and that will push it back up. Okay. And like I said, you can add one or more findings through here if needed, just by tapping in the findings and then typing in your finding. Okay. So maybe they have a little conjunctivitis in here. So I could go ahead and search for that. And it would drop that finding in. Okay. You also have the ability to remove it if you made a mistake, and then you can select by adding a new finding. So in the upper right again, I'm going to say done. You'll notice when I scroll down, or scroll up actually, here's my simple eye exam. There's my conjunctivitis. I documented in the right eye. Okay. If I scroll down a little bit, I can add additional exam comments by choosing the blue hyperlink right above additional exam comments. Then super easy to put in your impressions and plans from this detailed overview screen. Is all I got to do is choose my diagnosis from the dropdown, or I can search if I don't have it listed as one of my top by using the magnifying glass. I'm going to choose myopia. Notice my plans are popular because I've used this diagnosis before. So it's super, super fast. Tap, tap, tap to bring in all three of those plans. And then on the right-hand side, you're going to save it. Once you save it, it's going to bring up where you can choose the right eye, the left eye, or bilateral, indicating which eyes. So I'm going to say bilateral, done in the upper right-hand corner. That quick, it just dropped in my diagnosis for myopia, my counseling plan, my follow-up, and my refraction. Now, if you look at my follow-up, there's not a date in there. So this is where you can resume to bring up that specific plan. And I'm going to put my 12 months in there. And I'm going to say done in the upper right-hand corner. So that just added my patient should be scheduled for a follow-up within 12 months. Okay. Also, if this patient, like I indicated earlier, has an astigmatism, you'll notice on that light blue banner where it says myopia OU, you can actually delete, add plans, go to complexity and status. So in this case, this is a brand new patient. So I'm going to say it's a new diagnosis because it's a brand new patient. And then done in the upper right, and that will drop that in. So it says new DX next to myopia. You can reorder plans, and then from the more drop down, you're going to see a few different things that you can do. So if I want to associate the myopia with astigmatism, I'm going to select the third one down that says associate cause DX. And this is where I can associate that with astigmatism. Okay. And then again, in the upper right, you're going to say done. And it's going to add that right under my myopia OU with associated diagnosis. Now we have a regular astigmatism. Okay. Again, like super easy. If you have another diagnosis, I said they have some dry eye. I'll tap dry eyes as my diagnosis. My popular plans are over-the-counter regimen and counseling. So I'm going to tap those two. If you would want to see the patient back for a follow-up, you can search for that plan as well. And then I'm going to save. Again, I'm going to say bilateral, done in the upper right, and it drops that diagnosis and plan right into my screen. Okay. That's how fast you could do an exam. Now for the coding and the billing, it's up at the top of the screen. So you'll notice here, this is a new patient. So it's a 92004. And then I have my refraction, the 92015. Okay. At this point, if you are ready to finalize, you can just choose a finalized visit. I could send my prescription this way as well by choosing send RX in the upper right. Once I send that RX over to Encompass, it's going to turn green, letting me know that I sent over my prescription. So at this point, I'm going to click finalize. I would get my acknowledgement window that pops up. Once I choose finalize, it's going to go ahead and lock down my exam. So it takes you back to the patient's chart. You're going to notice it's finalizing my visit, and it'll take a couple seconds to finalize. Okay. So that is on the iPad. So I'm going to stop sharing for a minute because I'm going to share the browser and show you how to document on the browser. And while we're doing this, Linda, do you have any questions?
I do not see any questions, but just a reminder to everybody, if you have a question, just click on the Q&A icon on the right of your screen and you can enter your question there.
All right. Okay, I am going to reshare. Give me a second, and I am going to share the web. And Linda, can you see my login screen?
Yes, I can. Thank you.
Perfect. Thank you. All right, so now on the browser to perform a simple eye exam, I'm going to start off and I'm going to go up to the patient tab and I'm going to choose my quick list. So just like the agenda tab on the browser, on the patient's quick list tab here, this is where you're going to see all the patients that are scheduled from Encompass. You can search for this by any provider, specific providers, any facility, or all facilities. So I used my one patient, Lucille, earlier. You notice that one's finalized. So for the browser version, I'm going to go ahead and use Billy here. Okay. So I'm going to go ahead and create my link visit. And that opens up my exam for me. Just like on the iPad for my other patient, I went ahead and I filled out all of my clipboard information. I can actually mark it reviewed right here on the browser and it will drop in today's date if nothing's changed. Okay. The manage button is here if you need to go in and manage like I showed you on the iPad. And that's where you can, put in a scribe, archive a visit, same thing as on the iPad. The only difference here on the web, on the browser, if you need to archive, you would type in capital YES and then choose that archive button. And then again, it will hide that and take it away. So we're going to start off documenting the simple eye exam. I'm going to go through the same fields. We're going to add our chief complaint. We're going to add our history of present illness, review of symptoms. Super easy again on that light blue bar all the way over to the right-hand side. I'm going to tap add CC HPI ROS. And again, same fields, chief complaint, follow up, other if you want to manually type it in, and then review of systems. I'm going to tap chief complaint. I'm going to go ahead and say this patient's coming in. We'll just do blurred vision, right and left indicating OU. Just tap in the eyes. In the upper left-hand side, provide details. It's a new presentation. It's not a follow-up. Add a distance. Nothing associated. It's mild. It's been going on a few months. And I'm going to go to the bottom and save. So that brings us right back to the single screen. Okay. Again, I'm going to tap that CCHPI ROS. I'm going to go to my review of systems. Again, this is a new patient, so I'm going to mark it all reviewed. And I'm going to indicate that they're having a little poor vision by changing that radio button from no to yes. Okay. I'm going to go to the bottom and save. And again, it brings us right back. Okay. Now, to get into the vision exam, you could do it one of two ways. You can actually, on the light blue bar that says vision summary, you can go to add test to go to any specific test. Now, one you may use from this dropdown is the binocular, because this has floating actions buttons. So when I choose binocular, you'll see within the binocular tab, look at all these tests I can get to. Okay, so this is really nice and quick when you're doing any type of binocular testing. Okay, so I'm just going to go ahead and save that. The other way to get in to do your pre-test is to choose the vision exam icon, and it looks like it did on the iPad, and it goes through all of the tabs. Okay, I'm just going to go through here and mark the ones with the asterisks. I'm not going to go through all of the tabs today. So I'm going to mark the pupils motility visual field. I'm going to go ahead and put in my visual acuities. I'm going to choose my distance test type if I needed to, my correction, and then you could just enter them in. Okay. I'm going to go down on the left-hand side. I'm going to go to my IOP. I'm going to go ahead and add it in. I'm going to copy OD to OS, and then I can save. If you needed to add another measurement, you just click right down at the bottom and add in that second measurement. You do have the ability in a few of these tabs to delete now, where you did not have that ability before. So if I go down to like the Amsler grid and I put in here that it's normal and save it, which will keep me on the same page. Maybe I meant to put that it's abnormal. I could go ahead and delete, and then I can put in the right results. Okay. And that goes for the pachymetry tab, your counts, and your retinal thickness. So now you have the ability to be able to delete if needed. All right, I'm going to go ahead and save again, and I'm going to go back to my visit note by tapping the breadcrumb up at the top here. And then to perform the simple eye exam here on the browser, same steps. On the light blue header, it says simple eye exam. I am going to say I did not dilate the patient, so I'm going to turn it off. I'm going to turn on the deferred. I'm going to put in my CD ratios. And like I said, you can add findings as needed by starting to type in at least 2 characters to do the search. Okay. I'm going to say done. And that's going to drop in that I performed my exam. Maybe you need to add something you forgot. You can actually click on this little blue hyperlink that says eye exam, and it takes you back in where you can go through the different tabs and you can document something here as well. So maybe I need to document they have a little chemosis. I'm going to copy right to left. That quick, I could say done with exam in the bottom right. And that's going to drop that in my eye exam. Again, you can add other exam comments if you like to type in stuff manually. Right below it are my impressions and plans. You do have the ability to select special plans here if needed. I'm going to, again, choose my diagnosis. You could type in the ICD-10, or you could type it in. Again, here are my 3 popular. I'm going to do my counseling, my refraction, my follow-up, save. I'm going to choose bilateral, save. That quick, I'm finished. Okay. Just like before I showed you, you do have the ability to delete. You can add additional plans. So maybe I did a contact lens fit. I can add an additional plan to my myopia OU, and I can go ahead and search. I could spell. So I'm gonna do my contact lens assessment and save that. And that's gonna add that contact lens assessment in. Now, if I want to add any information, more information in that plan, I'm going to resume over to the right just for my contact lens assessment. And then I could go to my different tabs on the left. These actually are stating everything's within normal limit. The one tab that I really like in here is the plan tab. So you can choose, continue current modality. They're getting soft contact lenses. And then anything else you may need, okay? And then if they're coming back in, whether it was okay to dispense these or not, or even if you want them to call, whatever the case may be, okay? And then again, you'll say done, and that pops that information in right at the bottom. Again, if I have another diagnosis, I can go ahead and select from that drop down. Again, we can do, let's try something else this time. Let's do, maybe they have some allergic conjunctivitis. Okay. Notice I don't have any popular plans because I did not choose this diagnosis before. So I'm going to have to search for them because they're not popular yet. For each diagnosis you choose in select plans, the first time you do it, those plans will stick and become popular plans. So I am going to cancel. So I'm going to cancel for my allergic conjunctivitis. Maybe, it's a little bit severe and I want to write a prescription. Just start typing in prescription. You can write a prescription from here and then you can save. Okay. I'm going to say it's bilateral. Save it. So if I scroll down a little bit, you're going to see, please review and add details. So is all you got to do from this single sign on screen is resume your plan of the prescription, and you can select whatever you are prescribing. These are the most common. If it isn't listed here, you could go where it says drug name search and you can start typing it in. Okay. I'm just going to go ahead and give them something that's listed here. Certain information you have to fill out. This is already done, like my SIGs in here, the numbers of packaging, the quantity. You can specify the location. You could add notes to the pharmacist. You can put the dose frequency and indication. Those don't go to the pharmacy, but they will document in the patient's medication list in the clipboard. And then once I'm finished, I'm going to save that in the bottom right and close out. And now I just added my prescription, my medication, super, super fast. You can also choose your data review down here if you needed to review any type of data. And what it does is it takes you into the ocular exam room, and then you could document anything that may be needed through here. And this is for obviously tests and documents, independent interpretation of tests, or discussion of management or test interpretation. Okay. I'm just going to save my visit note to get back out of here. So we're completely done with our exam that fast. Okay. Over on the left, you have your I code calculation. You have your automated quality measures. If this was a medical exam, you would be able to see your EM medical decision-making calculation. And then you're going to see the coding that pulled based on our examination. Okay. Here's our vision code that it pulled. If for some reason you needed to bill it medically, you just tap 99203 and it will change it below. So these are the codes that are going to get sent over to the practice management. It's going to be my 92004, my 92310, and my 92003. 0.015 for my refraction. I could go ahead and finalize my visit, or I could go to the integrations tab to send my charges. That's going to send those CPT codes along with the diagnosis codes over to Encompass so you can check the patient out. And then if you do submit the charges this way, you'll get that blue or yep, green banner that just popped up indicating that you went ahead and sent those charges. Or like I said, you could finalize the visit. You'll get your acknowledgement window that pops up. And remember, this is going to lock down your exam. So once you finalize an exam, the only thing you could do is amend it to add a note. Okay. So I'm going to go ahead and finalize. It brings up your exam in a PDF format. If the patient would like a copy, in the upper right-hand corner, you do have the print option. You could scroll down or you could tap through the pages on the left-hand side. Everything in red is what you documented. So you'll see your CD ratios, you'll see my chemosis in there, my impressions, my plans, and it's going to be electronically signed by the doctor as long as you have your signature uploaded. I'm going to scroll back up and I'm going to click on my home tab in the upper left-hand corner. So I could go to my finalized notes for today. It's on this blue hyperlink since I finalized those 2 exams, one on the iPad and one in the browser. You'll see your exam. And then if you notice the action, okay, now it says amend. So like I told you before, once these exams are locked down, the only action you can take is to amend. So I will choose amend, show you how to do it. You'd want to put in a title. I'll just throw in test. And then something in the body that you need to add to the exam. And then you'll save it in the bottom left-hand corner. And once you save it, it's going to actually take you back to the patient's chart. And to view the note you added in, you're going to click on the date of the exam. And that's the first thing you're going to see. Okay. So there's my test, there's my X's. Then right underneath would be that exam again. All right. So you could see how easy it is to document using the simple eye exam feature on both the iPad and the browser version. It's honestly takes half the time. Not even that, probably. So it's a great feature. I would definitely suggest trying it and see if you guys like to use it. Okay. And Linda, that is all I have. Do we have any questions?
Thank you, Michelle. No, it does not look like we have any questions today.
Great. I am going to go ahead and let me share one more time for you guys. And then Linda could tell you how to get to our educational resources.
Thank you. Yes. So if you are looking for more training, please check out our other learning options such as documentation, tutorials, walkthroughs, role-based training, additional training webinars, one-on-one virtual training, and on-site training or consultations. You can learn more at eyefinity.com/education. And with that, once again, I would like to thank you, Michelle, for your time and sharing all of the great information today. And also thank you to everybody on the line for taking time out of your busy schedule to be with us today. This concludes our presentation.